Here's a conversation that happens in thousands of American families every single year. A parent needs to go to a nursing home. The family starts making calls asking about costs, trying to figure out how to pay for it. And someone, a sibling, an adult child, maybe even the parent themselves, says the words that feel like a relief. It's okay, Medicare will cover it. And the family stops worrying. And then somewhere between day 20 and day 100, the bills start arriving. And then after day 100, the bills become enormous. Thousands of dollars a month, every month, with no end in sight. And that's when the family learns the truth that nobody prepared them for. Medicare was not designed to cover ongoing long-term custodial care. Not the years of help with bathing, dressing, and eating that most nursing home residents need. That's not what Medicare is really designed for. Medicare is health insurance, and Medicaid, on the other hand, is long-term care coverage designed for those who qualify. Most families don't realize this until they're already dealing with a nursing home bill. Today's video is about what is and what is not covered, explained clearly without the bureaucratic language, so your family is never blindsided by this. This is one of the most important financial topics I'll ever cover on this channel. Share it with someone who needs it. According to polling by KFF, the Kaiser Family Foundation, 4 in 10 Americans incorrectly identify Medicare as the main source of coverage for low-income people in nursing facilities. 4 in 10. That's not a fringe misunderstanding. That's a large portion of the country operating with an incorrect picture of how nursing home care actually gets paid for. And that misunderstanding has real consequences. Families who believe Medicare will cover long-term care don't plan for the actual costs. They don't look into Medicaid early enough. They don't consult with a financial advisor or elder law attorney. They don't explore long-term care insurance while their parent is still young enough to qualify. And then the crisis hits, and the nursing home costs upwards of $10,000 a month in many cases. And Medicare coverage ends for that benefit period, and suddenly a family that thought they had a plan discovers they have no plan at all. I've structured this video in 3 parts. First, what Medicare covers and its limits. Second, what Medicaid is in general, who qualifies, and how the spend-down process works. Third, the 4 common ways families pay for long-term care, and what most people should consider doing right now. Let's get into it. Everything in this video is general educational information. Medicare and Medicaid rules, especially Medicaid, are complex, state-specific, and change regularly. This is not legal or financial advice. We'll point you toward professional resources throughout. A quick disclosure: some links in the description are affiliate links, meaning this channel may earn a commission at no extra cost to you if you use them. We only recommend services we direct our own family toward. Let's start with Medicare. Medicare is federal health insurance, primarily for people 65 and older. Most people understand that Medicare covers doctor visits, hospital stays, and medical procedures. What most people don't understand is what it does not cover when it comes to nursing home care. Here's the rule, stated as clearly as possible. Medicare can cover up to 100 days of skilled nursing facility care per benefit period, but only under specific conditions, and only for a limited purpose. Let's break down each of those pieces. First, the qualifying hospital stay. To trigger Medicare's nursing home benefit at all, your parent generally needs to have been admitted to the hospital as an inpatient for at least 3 consecutive qualifying inpatient days. There can be exceptions, but that is the general rule. A stay under observation status, which might seem like a hospital admission but technically isn't considered one, might not count toward that 3-day inpatient requirement. This is a common and well-documented issue that has caught many families off guard. That means if your parent was in the hospital on observation status and then transferred to a skilled nursing facility, Medicare might not cover the facility stay. This is worth asking about explicitly any time a parent is hospitalized. Assuming the qualifying hospital stay is met, here is how Medicare generally pays. Days 1 through 20. Medicare typically covers the full approved cost of skilled nursing facility care, no copay. Days 21 through 100. Your parent most likely will need to pay a copay of $217 per day in 2026, with Medicare covering the rest. Days 101 and beyond. Medicare generally may not cover additional skilled nursing facility days beyond that benefit period. Your parent, or someone other than Medicare, might need to pay everything at this point. Those numbers come from the Centers for Medicare and Medicaid Services. Keep in mind, most Medicare-covered nursing facility stays end up being short-term in nature. Rehabilitation after a hospital stay, recovery after a stroke, or recovery after surgery. There is one more distinction that is essential to understand. Medicare generally covers skilled nursing care, care provided by licensed nurses or therapists. Medicare does not usually cover custodial care, the ongoing help with bathing, dressing, eating, and daily living that many long-term residents need. When a patient no longer meets Medicare's criteria for skilled care, coverage may end depending on a number of factors, regardless of whether that patient still needs to be in a facility. Important note, the determination of what qualifies as skilled versus custodial care can be complex, and families have the right to appeal if they believe Medicare coverage has been ended prematurely. Appeal rights and timelines are strict, so acting quickly matters. To be clear, Medicare's nursing home benefit is valuable primarily for short-term rehabilitation. What it cannot do reliably is function as a long-term care financing plan. Quick reset for a second. If you remember nothing else from this video, remember this. Medicare is considered health insurance, while Medicaid includes long-term care coverage for those who qualify. Now let's talk a little more about Medicaid. Medicaid, not Medicare, is a primary payer for long-term nursing home care in America. According to KFF data, more than half of people living in nursing facilities have Medicaid as their primary payer. Medicaid is a joint federal and state program that provides health coverage to people with limited income and assets. To qualify, your parent generally needs to meet financial eligibility rules set by their state. Many states have relatively low asset limits for a single individual, sometimes in the low thousands, though rules and exceptions vary significantly. For many middle-class families, eligibility can happen through a process called spend down, using assets to pay for care until they fall below eligibility thresholds. And it happens faster than most families expect. According to a 2025 study published in JAMA Network Open, over a multi-year period, roughly 6 in 10 nursing home residents who began as private pay transitioned to Medicaid during their stay. At over $10,000 a month for care in some cases, savings that took decades to build can be depleted quickly. Medicaid also has a look-back period that varies by state, in some states up to 60 months. During this time, the state reviews prior asset transfers. Families generally cannot give assets away without considering potential consequences under Medicaid rules. Violating these rules can result in a penalty period where the family must pay out of pocket in some cases. Planning early matters. One more piece that matters for married couples. When one spouse needs nursing home care and applies for Medicaid, the rules often include some protections designed to prevent the at-home spouse from being left with nothing. The non-applicant spouse is generally allowed to keep a portion of the couple's assets and a minimum monthly income so they can continue to meet their own needs. These spousal protections exist, but the specific amounts and rules vary by state. This is another area where state-specific planning matters enormously. Now the question many families eventually asks, if Medicare doesn't generally cover long-term care, and Medicaid might require spending down most of assets, what are families actually supposed to do? Here are 4 common ways families pay for long-term care. Most families end up using some combination of them. Option 1 is private pay, using your parents' own savings, investments, home equity, or retirement funds to pay directly for care. For families with significant assets, this can work well for a period of time. The challenge is the math. At $127,750 a year for a private nursing home room, the national median from the 2024 Genworth Cost of Care Survey, even substantial savings can be depleted faster than many families expect. Option 2 is long-term care insurance, a policy that pays a daily or monthly benefit toward the cost of care. The challenge here is timing. Long-term care insurance is generally easier to qualify for and less expensive when purchased earlier in life, typically in your 50s or early 60s. By the time a parent has a diagnosis or notable health conditions, sometimes they may no longer qualify, or premiums may be significantly higher. If your parent is in their early to mid-60s and in reasonably good health, this is a conversation worth having now. We have a dedicated video on long-term care insurance coming up. Links to compare options are in the description. Option 3, often overlooked, is Veterans Administration benefits. If your parent served in the military, Virginia benefits may help cover some nursing home or home-based care, depending on eligibility, service-connected disability status, and other factors. If your parent is a veteran, this is worth exploring specifically. Option 4 is the path many families eventually take. Medicaid planning, working proactively with an elder law attorney to understand your parent's state's rules, protect assets where legally possible, and position your family for Medicaid eligibility when the time comes. Done early, this may allow families to preserve certain assets within the rules. Done too late or done incorrectly, families can face penalties, delays, and costs that significantly reduce what they were trying to protect. This is the most legally complex area we discuss on this channel, and it is the area where professional guidance is most valuable. An elder law attorney who specializes in Medicaid planning can make a significant difference in outcomes for many families. I want to acknowledge something directly. This is a hard topic, not just because the rules are complicated, though they are, but because the underlying reality is difficult to face. Most families spend their working lives building financial security, and the idea that a long illness or extended nursing home stay could undo years of that is frightening. It's one of those fears people don't talk about, the kind they push aside because it's uncomfortable to think about. I'm not here to add to that fear. I'm here to tell you that understanding this early, before a crisis forces the conversation, gives your family real options. Families who navigate long-term care more successfully are often the ones who planned ahead, who had the conversations, who got the right professional guidance before the emergency arrived. Most families don't learn this until they're already in crisis. You're starting to learn it now, and you should consult with a professional in your state. More than likely, by watching this video, you now know more about how Medicare and Medicaid actually work than most people. That knowledge has value if you use it as a starting point on your learning journey. The next step is in the description. Before you go, an important note. Everything in this video is for general educational purposes only. It does not constitute legal, medical, or financial advice. Medicare and Medicaid rules are complex and subject to change. Medicaid eligibility rules in particular vary significantly by state. Statistics cited are sourced from KFF, the Centers for Medicare and Medicaid Services, JAMA Network Open, and Genworth's 2024 Cost of Care Survey. Please consult a licensed elder law attorney or financial advisor for guidance specific to your family's situation. If this video helped you, please subscribe, because this is a series, and each video builds on the last. Next week, we go deep on long-term care insurance. Is it too late to get it? Is it worth the cost, and what to look for if your parent is still young enough to qualify? Share this video with your family. This is the conversation most families avoid until it's too late to have it. Links to find an elder law attorney, compare Medicare plans, and explore long-term care insurance options will be added to the description below. I'll see you in the next one.